Hi, I'm Adil Fattar and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-de-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. The purpose of a brow lift is to lift the brow. The reason you might want this does vary. In most cases, patients complain of the appearance of tiredness, which is due to their low brow position, giving a kind of more furrowed appearance. Other patients may dislike the look of their forehead lines or other lines around the eyes. These may be partly treated by brow lift in certain situations. Other patients may complain of skin in their upper eyelids. They may be candidates for upper blepharoplasty, have a look at the video, or they may be a candidate for a brow lift or a combination of the two. Some patients have a compensated brow ptosis. Ptosis means sagging, and the compensation is that when they're opening their eyes to look, their forehead muscles are working very hard to hold their eyebrows up, but when they close their eyes, the eyebrow drops into a low position. These patients don't necessarily benefit from upper blepharoplasty. Doing so actually makes the forehead ptosis worse, the forehead having to work harder to hold the eyelids open. Patients with compensated brow ptosis don't often benefit from upper blepharoplasty and benefit more from a brow lift. There are many options for brow lifting, each having their own pros and cons, downtime and benefits. Some work better for the outer part of the brow, some work better to help with lines around the eyes. It's important to know that surgery isn't the only option. For a mild brow lift or to recreate an arch to the brow, Botox is probably one of the best options you can use, being temporary, minimally invasive, and can be adjusted to your needs. If you have creases or lines in the forehead and around the eyes, Botox or fillers can be of benefit to that. If the general condition of the skin is crepey, then skin resurfacing or skin conditioning techniques can be of benefit, such as laser or chemical peels. So the options include upper lid blepharoplasty, which is dealt with in another video. The simplest option for a brow lift is what's called a direct brow lift. This is typically used in patients with facial palsy and as a reconstructive procedure, but takes a melon slice of skin away from immediately above the eyebrow, leaving a small scar situated just in the upper border of the eyebrow, and that lifts the eyebrow. This is an effective direct brow lift, lifting the brow right by where it needs to be moved. The downside of this is the scar, which can be visible upon close inspection. Another option is the transblepharoplasty brow lift, where the eyelid tuck scar is used, and through this scar a absorbable implant is placed that pushes the brow up from inside. This works by pushing the brow up rather than pulling it up, which is what the majority of the techniques do, but does have an absorbable implant and is limited in its uses. The most common technique that I use is a minimal access or endoscopic brow lift. These use a variable number of incisions hidden in the hairline, which allow us to go underneath the forehead and lift the forehead from above and pull it upwards. In the medial part of the forehead, in this area here, permanent sutures are used and looped around screws that are placed in the outer layer of the skull bones in order to suspend the forehead. In the lateral part of the brow, permanent sutures are sutured to the soft tissues in the temple region in order to hold the brow up. A technique that is less used nowadays but was the most common technique is what is called the open coronal or hairline brow lift, that places a scar across the top of the head or along the hairline to lift the forehead forward, peeling it off the scalp, allowing us to adjust the muscles and then redrape the forehead. It's a very powerful technique, but obviously has a very big scar and a significant downtime. After all these brow lifts, they all have a similar kind of recovery. Initially there'll be significant swelling and puffiness around the eyes and forehead area. It can be quite dramatic in some cases and takes a few weeks to settle down. In many cases after the surgery, you might have a drain coming out of one of the incisions in the hairline. This is to suck the fluid out and stick the tissues back down onto the scalp. You may have a head bandage when you wake up, and you'll be asked to use ice packs in the early recovery period in order to minimize bruising and swelling. Bruising and swelling are the most common, obvious signs that you will experience after this surgery. Where the sutures have been placed in the forehead, typically around the eyebrow area, you may see little puckers. These may last 1 or 2 weeks, sometimes a little longer, and will go with time. These are where the sutures have been placed in order to lift the brow. Rarely these puckers could be permanent. Swelling and bruising increases in the first 48 hours or so and then will subside over the next few weeks. You'll complain of tenderness in the area, and you'll probably experience a headache as well. After the surgery, and once the head bandages are removed if you're wearing one, then you'll be asked to shower and wash your hair on a daily basis to keep all the incisions clean. You'll be asked to avoid any activities that increase your blood pressure, such as straining, reaching, or leaning forward. This is to minimize the risk of causing a bleed after surgery. After the surgery, you will have permanent, visible scars, but we try and hide these scars, for example, in the hairline. When the scars are placed in the hairline, you will get some temporary alopecia, that is, hair loss around the area of the scar. You can think of it as the hair follicles going into shock, but they grow on 3 monthly cycles, and after this period you will tend to find the hair grows again. Alopecia could be permanent, but it is very unusual. Scars on the scalp are often hidden well by the hair, but they can stretch, and like any scars may be red or lumpy to begin with, or could theoretically form a keloid scar. Keloid scars on the scalp are rare, but are a possibility and would be difficult to treat and may require referral elsewhere for therapy. As part of the brow lift, the hairline might move. This is not usually a problem, but for those patients with very low or very high hairlines, this may be noticeable and may be anesthetic and something that you don't like. After any surgery, sometimes there may be skin pigmentary changes, such as slight redness or tan coloration, that may last weeks, months, or even years. This is not something I see commonly, but as it is on the face, it is something you should be aware of. Other risks include an infection. Infection risk is generally low in the head and neck area, but I'd still quote somewhere between 2 to 5% risk of an infection. Usually this would be treatable with antibiotic tablets. Rarely you may require readmission with antibiotics through a drip or even a return to theatre to remove pus from inside the scalp. Bleeding after surgery occurs, and this is manifest as the bruising. However, significant bleeding may lead to a collection of blood which may need to be removed by returning you to theatre, opening up the incisions and removing the blood. Once the bleeding has been stopped, everything's resutured and you're returned to the ward. This shouldn't affect your final outcome, but you will find it will make your recovery slower with more swelling and more bruising. The risk of bleeding is higher in smokers, those who take aspirin, and those with high blood pressure. And for this reason, all of these factors need to be treated before surgery is considered. In other words, stop smoking, make sure blood pressure is controlled, and discontinue aspirin at least 10 days before surgery. Sometimes fluid can collect underneath the forehead, and this is called a seroma. In some cases this may need drainage, but in the majority of cases it will absorb on its own. There are 2 important sets of nerves that are at risk in this procedure. The first is the frontal branch of the facial nerve which raises the eyebrows. This is at risk during our dissection, and there are well-known methods of dissection that minimize that risk, but they do not stop that risk altogether. More than likely, any weakness in that side of the nerve will be temporary due to stretching of the nerve rather than having cut the nerve. Permanent damage to the nerve is a risk and will leave you with typically a unilateral palsy, so that only one eyebrow will raise. If this is the case, then treatment will be directed towards restoring symmetry, and there are a number of techniques to do that. As a facial nerve surgeon in the NHS, I have a full suite of techniques that I can use to help you with this, the simplest of which is Botox in the short term. The other nerve at risk is the nerve that supplies sensation to the forehead up to about the halfway line of your scalp. Damage to this nerve again typically will be due to stretching and will come back over time, but will be manifest as numbness, typically irritating numbness when you brush your hair. Damage to this nerve may be permanent, and there is no easy way to fix or restore this sensation. Loss of fixation is another complication. By suspending the brow using permanent stitches, basically like ropes pulling up the eyebrow, they can snap or lose their attachment to the skull. If this is the case, the brow position will drop and will be significantly different to the other side. This will require return to theatre and refixation of the brow. The majority of these medical complications are unusual. The majority of complications are aesthetic complications, those which patients complain of due to the appearance. The most common of which is minor asymmetries. These are guaranteed. I will not be able to make each eyebrow look exactly the same. Nobody's does to begin with, and they won't be able to be the same afterwards. Such asymmetries should be within normal limits, but treating these asymmetries can be challenging, especially in a revision case. You may not like the appearance that you have. You'll spend lots of time trying to decide what you want and how you want to achieve it. One of the most feared issues is making you look surprised by over-raising your eyebrows. There will be a tiny degree of overcorrection, but it shouldn't be to the point where you look like this. However, you may feel that the correction has been overdone or undercorrected, or may simply not be to your taste. In this day and age, when we're constantly taking photos and videos of ourselves and sending them to the public, there will always be certain lightings, appearances and angles that you don't like. This is normal and natural. Nobody looks perfect at every angle all the time, and plastic surgery can't achieve this for you. In spite of everything that we've discussed in this video, you may simply be unhappy with the result that you've achieved, and that's why I'll spend as much time as possible beforehand trying to point out where you may be disappointed as well as where you may be happy with the results. The long-term nature of the results varies. There's lots of lifestyle factors that are involved, such as smoking, going out in the sun and so forth, and there's no way we can say that these results last forever. Over time, the brows will continue to drop as per the normal aging process, and perhaps the best way to think of it is as resetting the clock and then allowing the aging process to naturally continue.